Ugandan citizens are raising concern over the government's decision to extend the country's lockdown as part of attempts to contain the spread of the coronavirus pandemic. The East African country continues to record significant number of new infections, which have left some health workers worried of the situation. And President Museveni said his government will seek more support from its partners to acquire additional vaccine. Details of that in this report.
In a televised address to the nation, the Ugandan President Yoweri Museveni banned public and private transport. Only emergency vehicles and essential workers are allowed to move. Schools, colleges, worship places, entertainment and sports events will remain closed for the next 42 days.
These are urgent and temporary but extraordinary measures which we as the nation must jointly and fully embrace to protect and preserve our lives, our ways of life, the way we live and our future.
More than 1,000 patients are admitted to different health centers across the country, but many are scattered in private health facilities while other cases are being managed at home. Some Ugandans are not happy with the lockdown.
We have no food at home. We have loans. The landlords need their money. They will not listen to excuses. They would have allowed us to go to the village to pick some food. We are restless. This is not right.
The disease will not be eliminated today. They should allow people to move because even without cars, we are moving and the privileged are driving their vehicles freely. It's a waste of time.
Health officials say the country has been registering more than 1,000 cases daily. Many of these are severe and critical. Uganda is entering a second major lockdown, and doctors say while the measures are important to slow down the spread of COVID-19 infections, staying home has come with increased stress, anxiety and depression. Health professionals say since the onset of COVID-19 in the country, several health centers are reporting a rise in the number of patients seeking treatment for mental health issues.
If you have not heard from a person for 2 days and used to talk every day or 3 days, check on your people. But if you stay alone and there's no one checking on you, reach out to someone. It could be anyone, it could be a friend. Respond to a status. Ask for help. Very many people are not asking for this help because they fear the social stigma that they will face after they've declared that, you know what? In fact, most people are telling us after they're almost on their journey to recovery.
President Museveni says the government is also negotiating with partners like China to source for additional doses of COVID-19 vaccines. He believes when more people get vaccinated, fewer numbers will require hospitalization.